two.
Very good morning, everyone. Hopefully you can hear me well. So my name is Matthew Kusin. I work for Health Equity Matters as part of the Skip a 2 program based in Bangkok. I'm a senior technical advisor, and I'll be the host of today's webinar. So thank you everyone for joining. So today's webinar, we have a number of different guests from across the Asia Pacific region, and we'll be talking about sustainable PrEP and the future of PrEP financing in Asia. So this webinar is hosted as part of the Skip a 2 program. So the Skip a 2 program is the sustainability of key population HIV services in Asia Pacific. Sorry, just one. Uh, Sorry about that. So this or the Skip a 2 program is part of is working in a number of countries within the Asia Pacific region. And so that includes, we work regionally on sustaining key population HIV services, as well as we have country partners and work in specific countries. And so currently we're working in Bhutan, Mongolia, Sri Lanka, um, as well as Malaysia. And we've previously had work in the Philippines. And so, as part of this program, we have a number of objectives, including accelerating sustainable financing, as well as programmatic sustainability. And so our PrEP work really falls within both of these objectives. And so today, as many of you know and have been impacted across the region, the global funding landscape for prevention and PrEP, especially Asia, is really shrinking and has been impacted a lot, from a reduction in global donor funding, especially for key populations in this region. And so first off, we'll be setting the scene from UNAIDS. And so we have Veronique Collard, who is Equitable Financing Advisor with UNAIDS Regional Support Team based in Bangkok, who's supporting across the Asia Pacific. And she'll be talking a little bit about the status of prevention funding and PrEP funding across the region, followed by my colleague, Huiling Pan, who is our Senior Technical Officer for Health Financing. Will be speaking a bit more about some of the lessons learned within the SKIPA countries. And then my colleague, Nikki Suandi, will introduce our panelists. And so we have three panelists from Thailand, Malaysia, and Nepal who will be introduced during the panel session. So without further ado, I'd like to hand over to Veronique to start us off with setting the scene. Thank you. Veronique, over to you.
Thank you very much, Matthew. And good morning to everyone. I hope you can hear me well, and I hope that you can see my screen well. So first of all, thank you so much to the organizers for giving me the opportunity to speak at this event today about PrEP in Asia. In my presentation, I will first set the scene on HIV funding in the region, and we'll share with you insights based on the available data on PrEP spending that we have in the region. The evidence that I'm going to share with you today is based primarily on information reported by countries to UNAIDS every year in the context of the monitoring of the implementation of the Global AIDS Strategy. And so I would like to thank countries for their annual reporting to UNAIDS on these important financial indicators. I would also like to thank my colleagues in the UNAIDS regional team and Global Center for their support in preparing this presentation. My apologies, I'm struggling to move to the next slide. Let me try that. Okay, and hopefully you will be able to see well on my screen. So when discussing financing of PrEP programs in Asia and the Pacific, it's really important to understand the broader and very rapidly evolving financing context for HIV in the region. This graph shows the evolution of funding for HIV in low and middle income countries in Asia Pacific from 2006 to 2023. The red at the top of each bar represents domestic resources. The pink represents funding from the Global Fund, the darker parts represent funding through PEPFAR and other external funding. And I would like to share 3 observations on this graph. First, over the past decade, external funding for HIV programs has decreased by 60%, dropping from its peak of 1.4 billion in 2011 to close to 600 million in 2023. In addition, there is less diversity in international support. The Global Fund and PEPFAR now represent the vast majority of external resources, and there are very few other donors. Second observation, during the same period, the contribution of domestic resources has risen by about 50% to reach about 82% of overall HIV funding in the region. This is an important achievement that should be celebrated. However, 2 points here. First, the trend in domestic resources is concerning, as a decrease has been observed over the last 2 years. And second, the situation is very uneven across countries, with some countries like Malaysia, Thailand, India, funding the vast majority of their HIV responses, while other countries remain dependent on external support, such as Cambodia, Laos PDR, Nepal, and others. Third observation, it's important to remember that an important funding gap remains, and this funding gap has been widening since 2021. Resources available for the region are far lower the investment that is required to achieve the 2025 targets. So in this overall context, I would like now to give a closer look at spending for key populations programs and prevention programs in the region. And Matthew, I'm struggling to go from one slide to the next. Would you mind sharing from your screen, from your side? I think it would be perhaps more fluid.
Yes, I can try that. Give me 1 minute.
So if you can go to the 3rd slide.
Let me know if there's a problem, Matthew. Thank you.
So as you pull up the slides, I'll just continue talking. And so if you can go to the slide number 3. In the Asia-Pacific region, as well, HIV infections are among key populations and their partners. And the slide that you're going to see very soon shows the percentage of total HIV spending that was going to key populations programming in 2002, in the blue bar that you will see very soon, compared to the estimated total share needed in 2025 for each region in the world. And we will look specifically at Asia and the Pacific. Thank you very much, Matthew. So Asia Pacific on this slide is identified with the red circle. As you can see, about 11% of HIV spending in Asia Pacific was devoted to key populations programming in 2022, when we estimate that the share of 2025 resources is estimated to be about 1/3. So clearly there is a gap between the actual spending and the needs. So the overall funding gap that I mentioned earlier is compounded by a low share of financing for key populations programming. And clearly we can see there is an investment mismatch. But the situation varies greatly across countries, as you will be able to see on the next slide, please. This slide shows the proportion of spending on key populations programs out of total HIV expenditures for selected countries where data was available in recent years through the Global AIDS Monitoring. This shows that in 9 out of 13 countries where data was available, less than 15% of HIV expenditure were devoted to prevention programs for key populations. But so in that context, what is the role of external resources? And let us go to the next slide. This slide shows the amount and source of HIV prevention spending by region in 2023, with Asia Pacific again circled in red. Although in the region as a whole, domestic resources play a very significant role, this is less the case here, For HIV prevention, donor funding continues to be essential. Recent data reported to UNAIDS show that 12 out of 17 countries that reported rely on international sources for more than 50% of their prevention financing. So in that context, let me now turn to PrEP funding. Next slide, please. First, it's really important to know that data on spending for PrEP is limited because PrEP spending is often included in broader prevention spending categories. The graph that you can see on this slide summarizes the latest available data submitted by countries to UNAIDS. It shows that among 9 countries that reported expenditures on PrEP in recent years, only 2 reported domestic investments. This is also confirmed by a recent national aid spending assessments conducted in a few countries in the region. And for these particular countries, we found that only 1% of spending for PrEP was coming from domestic resources. As we know, the 2 main donors for PrEP in the region are PEPFAR and the Global Fund. In the year 2022-2023, PEPFAR spending for PrEP amounted to approximately 7 million in 10 countries. This amount was supposed to increase to 9 million for the year 2024-2025, with higher shares going to Vietnam, Thailand, Myanmar, and the Philippines. For the Global Fund, the spending that is specifically labeled as PrEP in 2024 amounted to about 4 million in the region. However, other PrEP spending is included under prevention combination for key populations, so it's difficult to have a specific number. So overall, the landscape is one of very high reliance on international sources of funding for PrEP, even more than for prevention as a whole. Next slide, please. And it's going to be my last slide. I just wanted to say a word about the question of ARV prices. This slide shows the procurement prices for specific ARV regimen as reported by countries to UNAIDS. I want to emphasize that these are prices for regimen that can be used for PrEP. It's not easy to distinguish in procurement data which portion of the ARVs procured, of specific regimen procured, are for ART and which are for PrEP. So I just wanted to mention this caveat. And it's quite evident from this slide that prices as reported by countries vary widely across the region. Many countries pay significantly higher prices for the commodities compared to the most recent benchmark procurement prices, which are around $35 to $40. So clearly, price-related barriers must be addressed to enable the effective scale-up of PrEP. And looking forward, access to long-acting PrEP will likely face additional challenges, particularly in middle-income countries that may not benefit from lower-tier pricing. Next slide, please. And so with that, I just wanted to thank you for your attention. For more information, you can refer to some available resources. The HIV financial dashboard that summarizes all the financial information reported by countries to UNAIDS, the data hub for Asia and the Pacific that you may be familiar with, and then finally, available national aid spending assessments at country level that provide granular data on HIV spending. Thank you so much.
Thank you so much, Veronique, for setting this stage and really giving us an overview of what the financing looks like for prevention as well as PrEP and the HIV sphere more broadly. So I think maybe we'll have one more presentation and then we can maybe pause for any questions. But if you have any questions in the chat, feel free to write them in the chat and then we can have a pause after the next presentation for any Q&A before we go into the panel. And so, yeah, thank you so much, Veronique. We see that really prevention is widely funded by international donors. And then even more so, you know, PrEP seems to be even much highly dependent on international donors compared to the wider prevention sphere. So next, I will hand over to my colleague Hui Ling Pan, who is our senior technical officer for health financing, to give us a bit of an overview of some of the work that we've been doing with SCIPA, and then more broadly, just some of the different financing aspects for PrEP that is possible. Over to you, Hui Ling.
Thanks, Matthew. I will rely on you to project the slides from your computer. I will first start by spending a few minutes on the Skip-a-2 experience to show how long it took us to lay the foundations for rolling out PrEP in some Asian countries. And there's still a lot of unfinished work to deliver the promise of PrEP in curbing the HIV epidemic. This is important because this lays the foundation of our conversation today about what is at stake when the reality is already before us that we must look at alternative financing strategies to sustain progress. The work to introduce PrEP started back in the last iteration of the SKIPA grant, which was the 3 years prior to the current grant. And we did a demonstration study in Mongolia, but struggled to find buy-in among stakeholders in Bhutan. In Bhutan, as you can see from the slide, with the government being more open to introducing PrEP in its HIV control strategy in 2023, SKIPA2 quickly acted to work hand in hand with the government and community partners to establish the policy frameworks, clinical guidelines, the systems, including sensitizing and training providers. As of last month, there has been over 80 individuals initiated on PrEP, but that's far short of the 931 target that's projected by the government by the end of June 2026. And among communities, there's still a lack of understanding of what PrEP is, what benefits it offers. Access barriers in a facility-based delivery model also sometimes hinder progress among those who are already receptive of PrEP. In Mongolia and Sri Lanka, we see two stark reminders of how fragile progress made under donor-funded projects can be. In Mongolia, despite a successful demonstration study that completed in 2023, PrEP service was not institutionalized in Mongolia health system and community systems. Due to new regulations around market authorization and gaps in the single purchaser e-health system, we see an awkward situation where the drugs are in fact already procured, but just sitting on the shelf of the clinics and not being dispensed to eligible individuals. Although Mongolia has a debt to health grant from the Global Fund, and that's offering PrEP drugs for 100 individuals as kind of a temporary solution, but that's being offered through a vertical program. So in the long term, the regulatory and financing barriers do need to be addressed urgently to ensure sustainability beyond donor funding. Sri Lanka similarly had success getting people on PrEP back in 2023, but once PrEP stops being routinely distributed to healthcare facilities and there's no M&E system tracking PrEP initiation, momentum quickly stalled. All these examples underscore how fragile the progress is if there's no continued funding to strengthen health and community systems to get people on PrEP. So what options do countries have if donors pull out suddenly, like we're seeing globally this year? International experiences offer a menu of options, but of course, context matters a lot. Here on the slide, I show a couple of examples along the spectrum of public to private funding options. On the left, we see, which we often advocate for, are the public financing, government-funded and implemented programs. For example, you have government-funded national PrEP programs, like in the US, where there was a federal initiative in partnership with Gilead Science to provide PrEP services to uninsured or underinsured individuals. The majority of the funding for this program comes from the federal government, but the drugs are being provided free of charge by Gilead. So the community health centers that offer the PrEP services under this program are funded by the federal government to provide consultation and health services and lab testing at reduced or sliding scale fees. Social health insurance is another mechanism to finance broad health services, including for PrEP. Implemented as subsidized by governments with individuals contributing premiums usually. For example, in Thailand, coming back to our region here, the National Health Security Office, which is the administrator of the Thailand National Social Health Insurance Scheme, they include PrEP, the medication, as well as the wrapped around medical services. I also flag an example of the compulsory schemes in European countries because many countries with nascent social health insurance schemes have their own sustainability challenge when there isn't sufficient contribution and risk pooling, and that limits the potential of the scheme to effectively finance for UHC. And in that context, sometimes the more marginalized populations and diseases impacting them can be deprioritized. But beyond directly funding, governments can also find other ways to ensure access to PrEP. And that's speaking to kind of the middle of the spectrum where there can be some hybrid models of financing. Private health insurance, for example, doesn't always cover prevention services, including PrEP. In the US, we have an example where the Affordable Care Act mandates private health plans to cover PrEP and related medical services with no cost sharing from the insured member. This is an example of a private financing model that is driven by public policy for a public health goal. Social impact bond is another option, which typically pools public funding with private sector investment, commercial investment, combined with an outcome-based payment model to drive development impact and results. On the slide, I listed Elton John Foundation's Zero HIV Social Impact Bond, the first of its kind. But I listed it on the private side of the spectrum, and that's because this particular SIB's primary pool of investors are from the private sector. The program funded by this social impact bond offers comprehensive HIV services, including PrEP. Solidarity funds is another example where private sector crowdfunding can be leveraged to achieve a public health goal. The Malaysia AIDS Solidarity Funds, which hopefully our panelists from Malaysia can speak to today, and the Swiss AIDS Federation Solidarity Funds, both have been used to finance some PrEP services in their countries. Lastly, on the right side of the spectrum, private financing. So this is mostly relying on out-of-pocket payments from individuals. We have manufacturer patient assistance programs, such as those offered by Gilead Science and other pharmaceutical manufacturers. They sometimes have advanced access programs for specific drugs, which offers the medications to patients free of charge or at a reduced price. And this is an example of private financing driven by corporations. Lastly, there's something called market segmentation, which is this idea that different groups of people have different needs and different ways to pay for HIV-related services, such as prevention, treatment, or care. And by dividing the population into segments, we can create more targeted solutions to make sure that everyone, regardless of their situation, has access to the care they need. In simple terms, in the case of financing for PrEP and other HIV services, it's about identifying those with willingness and ability to pay, finding service delivery solutions for them, and reserving public sector limited resources for the others. PEPFAR previously had several initiatives on this in the African continent. In the interest of time, I'm not going to go into more details about each of these models, but if you want to learn more about these examples, you can click on the hyperlink in the slide deck to access further readings. I'm sure the organizers will share the slides after the event. Now, for those in the audience who are government partners, you may look at the spectrum on the previous slide and think, there are many private sector financing options in limited public sector resource settings. But I want you to put yourself in the shoes of the client and imagine what it would be like having to navigate accessing PrEP services on your own and what this would mean for the disease control objective at the country level. To do this, I'm going to give you the US example, which has one of the most fragmented healthcare financing systems. If you're a client in the US who is at risk of HIV and should be initiated on PrEP right away, depending on your age, your employment status, your income level, where you live, whether you have disability or if you belong to specific groups like veterans, Native Americans. You would be eligible to receive PrEP medication and related medical services at free or reduced fees from specific programs. Each of these programs have their own rules and restrictions as to which clinic you can go to get this service, and there may be rules about costs that you may need to pay upfront, etc. Some people are bound to fall through the cracks even with all these programs. And this is why there was a federal initiative to provide equitable access to PrEP services to the uninsured and underinsured. However, this program will end this July, leaving people to rely on other patchwork programs from the state and pharmaceutical manufacturers. So in closing my presentation, I want to leave you with this thought. We all know that PrEP is a proven cost-effective tool for controlling the spread of HIV. And even though there can be a range of options to finance the medication and the wrapped around medical services across the public and private spectrum, it is critical for governments to take the lead in ensuring universal access to PrEP as a public good to ensure that everyone at risk has access and to make sure that PrEP can deliver its promise for curbing the HIV epidemic. Thank you.
Thank you so much, Bailey. So I think we can stop here, and if we have any questions, as of now, we don't have any questions in the chat, but if anyone wants to raise their hand and have any questions for Huiling or Veronique, we can take those at this time. Okay, I don't see any questions yet, so maybe we can move on to the panel presentation, and if any questions arise, we can take those in the chat. And so I might hand over to Nikki Swandi from AppCom, who's the Knowledge Management Officer, who will be moderating the panel, and he can introduce our esteemed panelists. Nikki, over to you.
Hello, thank you, Matthew, for the introduction. I'm going to invite our three speakers for the panel in alphabetical order. So I'm going to invite Kao Pubet Panpet, or I would like to call her uh, Kun Kao. So um, who's a senior specialist on mental health and transgender from M Plus Foundation, a key population-led health service provider and community-led organization in Thailand that provides comprehensive sexual health and HIV services, particularly for MSM and transgender individuals. M Plus operates clinics and mobile units across northern and northeastern Thailand, and offering comprehensive services from testing to psychosocial support. So welcome, Kun Kao. Next, I'm going to call Prashuram Chaudhary, Program Manager from the Blue Diamond Society in Nepal. BDS is Nepal's leading community-based organization advocating for the rights, health, and dignity of LGBTQI plus individuals. Blue Diamond Society has been instrumental since early 2000 in advancing legal recognition, providing HIV-related services, and promoting social justice for the most marginalized communities across the country. Is Prashu here? Yeah, hello, Prashu. Yes. Welcome.
Hi, this is Prasu.
Yeah, welcome. Okay, so last but not least, I'm going to invite the third speaker, my friend and colleague from Malaysia, Wan Ikhtiaruddin, or like to be called ATS, Program Assistant Manager at Malaysian AIDS Foundation. So Malaysian AIDS Foundation support HIV/AIDS prevention, treatment, and care initiatives for key population communities in Malaysia since the 90s. It works in close alignment with Malaysian AIDS Council and a network of community-based partner organizations to implement programs and services. So welcome to the three of you
Thank you. Thank you.
in our panel. Give me a second. I need to open the. Oh, hold on. So hopefully everything is going good today. I'm really delighted that the three of you accepted our invitation to participate in this panel. And this webinar is very important as well as timely given the current situation that we have at the global, regional, and also at that impacted global, regional, and as well the country level as well. So oh, I just realized I haven't turned on my camera. Okay. Hello, hello, hello. So, maybe without further ado, we can just start about, the panel. It would be like, relax, short, like, talk show format. So please, don't get nervous. I know the three of you, like, are very wonderful speakers. So, maybe, I'm gonna start with the first, question for today. What have been the biggest successes you've experienced in delivering community-led health services, particularly PrEP, in your country? Anyone would like to?
Okay, I would like to share.
Thank you,
First
President.
first of all, my name is Prasu. My gender pronoun is he, and I'm genderqueer person working for BDS since 2022 as a program manager in HIV program, especially. Before your questions, I have some, I want to share my experience because Blue Diamond Society played a vital role to generating demand for PrEP among key populations, which was particularly challenging in the initial phase due to widespread stigma and negative perceptions surrounding PrEP. Many community members were hesitant, fearing discrimination and misunderstanding. However, through consistent promotion effort of Blue Diamond Society carried out by the community-led supporters called CBS and peer navigators, and by establishing its own dispensing site, BDS gradually built trust within the community. Yeah, in PrEP, BDS gradually built the trust within the community. As a result, the number of PrEP users steadily increased year to year. Yeah, and another major hurdles I want to share a little bit from the skepticism of healthcare providers who initially lead negative attitude towards PrEP. There was several misconceptions about towards them, such as kidney failures, like fear-related fertility. Through persistence advocacy of Blue Diamond Society, awareness raising, and engagement among the doctors, healthcare providers, BDS successfully addressed this misconception. Over time, healthcare providers' attitudes shifted, enabling a more supportive environment for PrEP services as well. These two transformations is both community acceptance and healthcare provider attitudes stand out as a BDS key achievements as a PrEP service provider since Nepal. Yes. This is the two major achievements that BDS achieved our struggling, As a community-led service provider, we have had significant success in delivering PrEP services in Nepal, such as in the beginning phase in 2020, when PrEP we started, we just reached 11 KPs. But right now, due to our continuous effort and media promotion, social media influences, we have right now, to date, 6,745 KPs. That means MSM, transgender, and FSW have received PrEP services directly through BDS. So that's it right now. And nationally, I would like to share, in Nepal, all total 16,119 individuals across Nepal have access to PrEP. Yes, thank you so much. This is our achievement right now.
Great number. Thank you. Thank you for the
Thank you so
insights
much.
about Nepal. So, Pika or Eds?
Sure. Greeting everyone. Can you hear me well?
Yes.
Okay, my name is Kao and I work at M Plus Foundation, a community-based organization rooted in Chiang Mai and 5 other provinces with over 2 decades of our experience working in the community and offer the community comprehensive service package for the key populations. For PrEP demonstration project. Around last 10 years, MPlus has been forefront to PrEP advocacy and delivery. And right now, MPlus has registered as a National Health Security Office node. So right now, we can reimburse for the service, including HIV prevention, testing, and the PrEP service from the NHSO. But for only the universal health coverage, not for the social security. And last year, MPlus Chiang Mai was registered as the polyclinic to offer the comprehensive HIV service package. This allowed MPlus to receive the compensations for all HIV cascade, including PrEP service. Our model can reach thousands of the clients who cannot access to the service in Chiang Mai. And our future, we try to expand to other side of MPlus. One of our biggest challenge success has been initiate PrEP service among the key population around 1,000 of the clients. And the last year, we expand the PrEP service with the collaborate with the hospitals and the prison in Northern to expand the service to the key population in the correctional facilities in 10 prisons to reach more of the key population in the prison. Around 100 can continue to initiate on PrEP, and 61% continue taking PrEP after 3-month follow-up in the prison. And our next plan to, after they go out from the prison, we need to make a plan for follow-up them into our clinic. That's kind of our success on the last year.
Thank you, and that's very interesting to know that MPlus also work in the closed setting prison. So I might have some question about that, but let's hear from Ed.
Okay, thank you, Nikki. And also thank you to the panels. I am honored to be here again and share the PrEP journey in Malaysia. So let me give some background for PrEP in Malaysia. So basically, PrEP in Malaysia available almost a decade ago, but only available in private clinic. And of course, it's actually out of pocket. Since January 2023, so around last 2 years, we started our PrEP Gov program, which actually being led by our Ministry of Health Malaysia, and we started at 18 government clinics. And now this clinic has been expanded to 35 clinic kesihatan. So basically, clinic kesihatan is actually a government clinic, and it offers PrEP across Malaysia. And we support the program via our PrEP navigators. So we have around 30 trained PrEP navigators who actually come from the community that we serve. Basically, PrEP navigator provide more than just information about PrEP. They also help clients start and stay on PrEP, and of course, follow up to ensure the long-term support. And together with the community health worker or CHW in Malaysia, they led the demand creation activity and also increase the PrEP uptake in Malaysia. In Malaysia, currently the uptake is around 350 new client for PrEP per month, and this is actually a major success in Malaysia, where the PrEP services actually can attract people, especially those who are never been tested for HIV before. And it is also important to understand that in Malaysia, PrEP is not just about the pill. PrEP is not just about the PrEP itself, but it's actually the full package of risk reduction counseling. Okay, and through one-on-one session, PrEP Navigator helps clients understand the behavior, explore safer option, and also make informed choices. One of our biggest success is actually the PrEP program in Malaysia has helped bring HIV prevention service closer to the community. And currently, we have more than 7,000 PrEP users in 2025 alone. Okay. And it's also need to be mentioned here that Malaysia is actually Muslim majority and conservative leaning country. And we have lots of challenge to start the program in Malaysia, but I think this is um, not going to be possible if without dialogue with the stakeholder, including the religious authorities. So I would like to take this opportunity to thank the Ministry of Health of Malaysia for the strong support and partnership for the program. And I would like to, I am pleased to inform that the PrEP program in Malaysia that we started in 2023 as a PrEP demonstration project is now being made permanent by the Ministry of Health Malaysia with the funding from the government side. And in July, it is going to expand it to all clinics that carry 10 FEM. So this is actually something that we are truly proud of. Thank you, Nikki.
Thank you. Congratulations. Really good to know that the PrEP program is being adopted or fully funded. Yeah, correct. Fully funded by the government is really good to know. I remember Malaysia was one of the earlier implementer of PrEP in the region. I come from Indonesia, which PrEP just available around 2 years ago. So we've been waiting for such a long time. So okay, I have the second question. How has the current, since we are in unprecedented times, so how has the current or upcoming reduction in donor funding impacted PrEP access, and in particular community-led PrEP initiatives? What strategies have you used to adapt to these changes? Again, this is open for anyone who would like to answer first.
Who wants to be first? Can I share?
Okay. Yeah,
Okay.
no worries. That's it.
Okay. Okay. I mean, your question is first like this is a kind of challenges, I guess. Like community-led PrEP initiatives, Blood Diamond Society in the beginning phase, like we do struggling in the beginning phase for demand generation for PrEP, but due to the stop order, about the USAID stop order, we are completely stopped. This is our main challenge. It's impacted to our HIV program, in prevention program. Secondly, community trust has also declined. After the stop order, we are not able to provide the PrEP to the key populations, our PLHIV, our PrEP seekers. So this is one of the thing is like community trust also declined. As they says, like, people know, like, see PrEP as a donor dependent service. They said, like, they said, like, service only available for when supported from the external funding, otherwise no, otherwise discontinue. That's why we declined the support. And another is like, however, the frequently demand PrEP from the PrEP users, we are not currently available to PrEP, stigma-free PrEP services as well. This is one challenge. Another is like, this inconsistent availability, has created a frustration among key populations and posed serious public health risks right now. In Nepal, there is now a high possibility of an increase in HIV prevalence due to the interruption in PrEP services and stop order of US government. Another thing is like in Nepal, the Nepal government has not any initiatives to continue or support PrEP, resulting in complete lack of discussion or planning around the availability. This is another challenge we are facing right now. And especially
Thank you.
okay.
Yeah.
Okay, my time is off.
Thank you, Prasad,
Okay.
for the explanation. Um, we really hope for the government to for more government buy-in, or really taking care of our most marginalized communities, right? Eds or Pikau, you want to share about the question?
Maybe I can go first. Okay, so I believe that the reduction in donor funding is actually a bit worrying, right? Especially in this current situation. And also for Malaysia, our PrEP navigator is actually being funded by Global Fund. Okay, so I don't think that without the Global Fund, that basically we are going to lose our community connection that keep people engaged with PrEP. Um, and we basically work closely with our Ministry of Health. Now we already started strengthening our community team member by giving them more skill and also responsibility so that they can continue to support the clients in multiple ways. So basically, previously, if they only focus on PrEP, now they are going to focus also be responsible to look after the HIV, STI, and also hepatitis C cases. And hopefully, once the fund is already when the global fund pull out from Malaysia, and also the fund is actually depleted, all the PrEP navigators currently we are going to change it to the peer navigators are going to be absorbed by our MOH, and also under the our current existing program, which being funded locally. And also, we are moving forward towards social enterprise model. So we are exploring these models right now to generate our own income and to reduce the dependency on the external funding. And hopefully, this program going to be independent and also to ensure long-term sustainability. So I believe that there is some ways for us to prepare for the future with the less funding and also donor, while still keeping our community at the center of PrEP delivery, especially and also for the HIV prevention services. Over to you.
Thank you. Thank you. Good to hear about the sustainability plan. And Pikau, please.
Okay. Like many the community-led initiatives, we are feeling the pressure of declining donor support. Reduced funding has limited outreach activities, peer-led education, or the demand creation among our key populations, limit access to PrEP initiative, and a lack of supply that we have support from the international funding right now, and or the follow-up support. And as we know, the reduce of the funding, our staff feel stressed to continue to work. Some of lack of support or the supplies, but we adapt to continue to provide and offer our service. We in Chiang Mai and other provinces that MPlus have the sites, we build the partnership with the public hospitals, because they can reimburse the PrEP stock or the lab supplies from the government support. So we try to take a partnership with the public hospitals to continue to provide the PrEP for the key populations, but not only for the with public hospital, but we established the social enterprise from our polyclinic because we can reimburse from the NHSO. So we expand the service on fee-based or co-pay program for the clients who can pay. But if they are not, we reimburse from the hospitals. That's kind of two models to continue to provide PrEP service. Yes.
Thank you.
Also,
It
can I
is
share
okay.
something?
Yeah,
Okay.
please.
Strategically, Blue Diamond Society in Nepal also make a plan for sustainable PrEP. In further first, BDS taken in action about the continuing the documentation of PrEP users, first thing, and success stories also documentation by the Blue Diamond Society continuously, one of the key strategy for future sustainable PrEP funding. And another is like Blue Diamond Society always continue regularly advocating with the National Center for AIDS STD Control, Nepal government and Health Ministry for service continuation. Though we are not getting any support right now. Though the next one is like in next coming UPR, Blue Diamond Society will strongly raise the issues related to PrEP and the HIV prevention as well. Another strategy we have developed, like we have empowered, trained community-based supporters and peer navigators to support PrEP. Yeah, that is our strategy right now.
Thank you, Prasho. You highlighted an important point, like at least for what we can do right now is really make a good documentation and profiling of our work because let's face it, this is not going to be forever. But yes, Pikau, I also hear you that this is such a crazy time and it brings a lot of stress with the uncertainties about the future, right? So we feel the same. So yeah, still in relation to the question number two, I have another question. So about this situation right now, has your government taken any steps to sustain or expand PrEP access as donor funding declines? What specific advocacy ask or requests has your organization made to ensure continued access for key population? Shall I repeat the question? Since
I understand. No, I
since
understand.
Prashu, I think since the round is already start with you, maybe right now backward.
Okay. Okay, sure.
Just for variety. Maybe Pikaw na.
Our Thai government seems to have made the progress, including recognizing the community organization as vital PrEP provider. However, uh, we still need more investment from the government to sustain and scale up this service. There are still large gaps in demand creation in my country. So we need to advocate for funding that service and monitor PrEP service, especially hard to reach group, like other key population, migrants workers, and other key population, and permanent integration of PrEP into the national health scheme. Not only the universal health coverage, but also the social security. A big people as the employer is under the social security scheme. So we try to push this policy. We commend the Thai government to progressive support PrEP under all of the health coverage. And the policy reform right now to allow task shifting from the community provider, not only for doctor or the nurse in the hospitals, but shift to the community workers to initiate and review PrEP and fund directly that I have mentioned about. And I believe that community system, when fund and recognized, can fill the major gap for PrEP service. Thank you.
คุณค่ะ so ads
Okay, thank you, Nikki. So currently in Malaysia, the program that we run basically being co-shared with the Global Fund, right? okay, where the Global Fund is actually we fund for the PrEP navigator that going to be transitioned to the peer navigator, the medication and also the kits. Meanwhile, the Ministry of Health taking care about the clinical parts, about the doctors, about the place, and also the human resource at the clinic. And starting in July, the Ministry of Health going to take over for all the kits, all the medication. So Ministry of Health going to fund that. All right. So and we only need to fund for our human resource for the peer navigator coming forward. Um, because of the Ministry of Health of Malaysia has taken a clear step actually to sustain and also expand PrEP, like what I said previously, we are going to expand to all clinics that carry tenofovir basically in Malaysia. And this is actually the biggest achievement as the decision to make the PrEP permanent in government clinic and also to expand using the national fund. I think this is actually would not have been possible without the strong data to back up it. That's why in Malaysia we started as PrEP demonstration project in a small scale before we expand. And in addition, I believe that the program itself is not just about the HIV prevention, because in Malaysia data, we showed we have been seen that the PrEP program also contribute in reducing the incident of the STIs, specifically syphilis. As the individual receiving PrEP, they are more likely to engage in safer sexual activity, sexual practices, right? And also, like what I mentioned previously, in Malaysia, the PrEP is not about the pills, but about the risk reduction package. And I think this combination of the data, the advocacy, the demonstration of the reduction of STI amongst the PrEP user in Malaysia and also strong partnership has helped us move beyond the pilot project, the demonstration project to the sustainable public health services. So yeah, so I feel proud basically because of the project has been taken by the government of Malaysia. Thank you. Okay.
Thank you. Prashu, yes.
Yes. Yeah, and regarding Nepal, there is Nepal is completely depending on external funding regarding PrEP. For PrEP services, which completely depends, completely support from USAID and PrEP. So in relation to Nepal government, there is no any concrete action steps taken by the Nepal government for expand PrEP access. PrEP remains absent from national health priorities right now. Although a national PrEP guideline exists in Nepal, there has been no visible government response or commitment or operationalized. PrEP in Nepal were primarily provided by the BDS with support from the EPIC Nepal project, which is ended in September 2024. Since then, BDS directly get funding from the USAID from October 2024 to February 2025. On that time, we provided PrEP with the support of PrEP, but since then there has no any back continuation of PrEP services like none. And we advocating with the different external funders like UNFPA, others supporting agencies. Currently, we have lack of getting fund, but advocating continuously. In relation to HIV prevention, like lubricant and condoms, we continuously advocating with the Nepal government as well. This is the scenario right now in PrEP prevention. Yes, thank you.
Thank you. Thank you. Thank you for all the great sharing. Let's move to other questions. I think we still have a little bit of time. Okay, so what would you advise other community organizations facing similar funding cuts? Are there any tactics, partnerships, or approaches that have helped you most with the government or private sector to ensure PrEP is still available? Yeah. This is not a mandatory for everyone to answer, but only.
I just want to share one sentence. We are facing like it's completely depends on our external funding. This is a situation as another way, but we don't have any options like any options, any strategy, any tactics with support what they are doing. They are also facing the same problem in PrEP like BTS in Nepal. So I don't have any concrete answer regarding this. Yeah.
It's okay. Thank you, Prashu. Pika or X, but it's not a mandatory question. But would be great if you can contribute.
Yeah, some of my advice is the partnerships and build a long-term relationship with the district hospitals or the local public officials. Yeah, because these relationship or the partnership can help us to survive or share the facilities from our government right now. But for the future, I need to change some of the legal to allow communities to offer the service by ourselves. And I totally agree more about the data, document everything. Because our data can change all of the policy, all of the initiatives. This kind of from my experience.
Yeah. And those data also could be a very important advocacy material for advocacy tool, right? So
Okay.
yeah.
Okay, so I do agree with Panpet that we need to have a good collaboration with the clinics and the hospitals, also for the stakeholder. And in this challenge time, as for Malaysia, we are also exploring other funding, like because in Malaysia we start to have tripartite partnership within the government, NGO, Malaysian Aid Council, Malaysia Aid Foundation, and also the private sector to fund our program. And basically, we are planning to expand our program despite the challenge that we have at this moment. And I also agree that without the data, we couldn't make any improvement. We couldn't make any step further because we need all the data. Because in Malaysia, I believe that we use the data to convince the higher people in the ministry to take this pilot project into the permanent project, because of we do all the projections without the PrEP program, what's going to happen to Malaysia in 2030, without if we do the business as usual, what's going to happen, and with PrEP, what's going to happen. So this basically all the data that we need, and also the projection. As what you said, as what you said, that the data is actually a really strong advocacy tools to ensure that the program and also the PrEP are still available and also sustained in especially for our community.
Thank you. Thank you. Very beautiful and thoughtful. Thank you. So I think while we still have time, so I'm gonna have the last, which is asking a closing remark from the three of you panelists. What gives you hope right now? Whether it's something you've seen in your community, your team, or the people or the community that you serve that has helped you to keep fighting for access for PrEP.
Or people give us hope, even in the community. Our clients or the people still lines up to get a test, ask the question about PrEP, about self-testing, about treatment or care. They wanted to protect themselves and treat themselves. They need us. And please don't give up and stay resilient. The community service, not just not just sustainable, it's essential. Don't give up.
for our
Yeah.
community.
Yeah. We are not giving up for our community. Anyhow, we have to, we'll try to provide the services for HIV prevention because it's a very, very, like required our community as well because of our key situations and key populations as well. Our hope through Blue Diamond Society, from Blue Diamond Society, from my side, I would like to share just one thing, like community demand, always, all the time, community demand is one of our powerful documentation. So we need to make the documentation of community demand PrEP. First, and awareness is continuously, we do continuous awareness about this PrEP as well. And also dedicated and resilient staff team members we have, working across 20 districts in Nepal with sub-partners, and they are all resilient regarding PrEP. That's why we are hoping like PrEP is again PrEP come, then we will provide the service as well. And next, we have in past experiences very good. Past success, we have lots of success stories regarding PrEP users, PrEP services, and trust build are the major the things that hoping us for the sustainable PrEP. And waiting, lastly, Nikki, I would like to share like this, waiting for the whatever is sharing or not, I don't know, but hoping for support of like, APCON, like another supporting agencies. We are hoping from those external funders as well. So this is our hope right now. Thank you.
Thank you. Last but not least, Eds.
Thank you again, Nikki. So about the hope, right? Okay. I think what actually gives me hope, basically in this prep program is actually how much the ownership and also leadership has grown within our community, and also because we have seen that client who once hesitate to get tested, who once hesitate to get PrEP has now become an advocate and also encourage their friend to get PrEP. And also, I've seen that PrEP navigators and also our community health worker go beyond their roles, not just to support the clients, but also building trust and also breaking stigma and also helping people feel seen and also heard, especially in the HIV prevention. And I also actually inspired on how the community and also the government are working closely together, working together more closely than ever before because we are because of this program, because we have the challenge, right? And I think because of each side, the community and also the government side and also the private sector listen to each other, and because we believe that the power of the prevention instead of the power of better than cure. So especially in Malaysia, because of we have the conservative environment with many barriers. Previously, when we started the PrEP, we couldn't even advertise about the PrEP at clinic kesihatan or government clinic. We couldn't mention that PrEP is free in Malaysia. We couldn't say that PrEP is available for MSM, for the KP, for the TG, for the sex worker. We couldn't even mention that. That is actually the challenge for us. I believe that our panel can talk about the demand creation, but now, since it's already being a program, we actually are going to do more, hopefully. And the hope for me come from seeing the PrEP is not just a pill, but it's still a pathway to dignity, to safety, and also to the health of the people that often been left behind, which is actually our community. So thank you.
Thank you. Thank you for a very inspiring and inspirational remark from our panelists today. So thank you so much. It's really good to hear Eds that the community workers go beyond the extra miles outside of their job description. So, but be sure we need to take care of ourselves because, we always take care of our community that we love, but sometimes maybe we forgot who actually take care of us, right? So, that's also like important self-care. While in this crazy time, stay sane, hold on, but don't stop. Hopefully, don't stop working for the community that we love and we serve. Thank you. So, I think that's the end of our panel discussion today. So, thank you so much. Khop kap, terima kasih, Dhanyabad, Prashu. So,
Thank you so
thank
much,
you so much.
Nikki. Thank you so much, Nikki, for coordination all the time and supporting us to listening as well. And thank you so much from Blue Diamond Society and myself as well.
So right
Thank you,
now I
Nikki,
give back
Epcon, and
to
also
Matthew.
so
Oh, yes.
okay.
Nikki.
Thank you, Nikki, Epcom, and also all the other panelists. Because I've learned a lot from other countries for today, and also we can work together for our community and also to end AIDS by 2030. Thank you.
Great. Thank
Thank
you so
you.
much, Nikki, and all the panelists, as well as our two presentations earlier today. I think, as we've heard from the speakers, the urgency is now in terms of, increasing the domestic financing. But as Pikau has said, like in the past 10 years, we've gained a lot of traction. There's a lot of demand for PrEP. 10 years ago, it was very minimal in our region. And so now we have huge numbers of PrEP users and PrEP demand. And so it's really a call to action for domestic governments to now provide the funding because, the international funding landscape is really diminishing. And so we really need to shift. And we have seen a lot of good progress. And thank you for our panelists for sharing those insights. I think especially Thailand and Malaysia has done a lot in terms of the domestic financing. And we've seen a lot of progress in the domestic government actually putting funds to fund PrEP now. And so thank you so much to everyone. And we'll be sure to share the presentations and have a lovely afternoon. Thank you. Bye-bye.
Thank you.